Iheoma Iruka, PhD. Dr. Iruka is a research professor in the Department of Public Policy, a fellow at the Frank Porter Graham Child Development Institute, and the founding director of the Equity Research Action Coalition at the University of North Carolina, Chapel Hill. She leads projects and initiatives focused on ensuring that minoritized children and children from low-income households, especially Black children, are thriving. Her work is focused on ensuring excellence for young diverse learners, especially Black children and their families, through the intersection of anti-bias, anti-racist, culturally grounded research programs and policy. Dr. Iruka will help us understand the role racism and other systemic inequities play in the well-being of Black, Latino, Native American, and other children from minoritized communities. Dr. Iruka, welcome. Thank you.
Thank you so much, Cherie. I'm so glad to be here with you and with everybody else. And thank you, Cherie, and obviously NIHCM for really providing this great space for us to talk about children's health and writ large, of course. Again, Iheoma Iruka, my pronouns are she, her, hers. And I just want to say that I'm going to talk a bit about really the impact of racism on Black children's health. And I want to sort of take an advance in protection, promotion, and preservation policies. And I want to just take a moment. Can you go to the next slide, please, for me? Thank you. And I'm very intentional about putting Black on my slides, especially. I ground my work in Black children, Black families, and Black communities, but also recognize that many minoritized communities, including our Latino community, our Asian American Pacific Islanders, our Native community, even including our LGBTQ, rural, and many other communities are really impacted by racism and other systemic inequities. And so for me, it is important that as I center my work on Black children and families, that I also recognize and work with other organizations who may focus on other sort of subgroups and other populations. And so what I just wanted to briefly do is, next slide, please, is to just share a little bit about the Equity Research Action Coalition, and then also just, because it'll give you a sense of, you know, the lens that I'm bringing to the work and the conversation that we'll have following our remarks. So just again, briefly, the Equity Research Action Coalition, and there's a QR code there. Feel free to use your phone or a computer. You can sort of go to the website. And really, I just want to highlight that we're trying to really focus on co-constructing actionable research and evaluation with practitioners, policymakers, advocates, et cetera, to really support the optimal development of Black children and other children from marginalized communities, again, like our Latina, Native, children with disabilities, children living in poverty, really starting from prenatal through early childhood. So really through that prenatal through age 8, age 10 space. And I would argue that we're really working at the intersection of research, practice, and policy, but using what I call the two frameworks of anti-racism and cultural wealth. One is recognizing the system of inequities is baked into so many things, from healthcare, labor markets, education, et cetera, but also recognize that many communities of color, many marginalized communities really have a wealth of assets, from their family to their communication to so many things that we often overlook as we look at, obviously, the remnants and the travesty brought on by structural racism, brought on by systemic inequities and many other dehumanizing policies and programs that impact, you know, disadvantaged communities. And so really try to make sure that we're bringing those two lenses into our work. Next slide, please. And really, we do that through really, and again, as I said, we do really around the early years. So looking at our research and evaluation from a holistic perspective, that's not just about what is horrible happening, but what are the other assets that our children are bringing, that early care education providers are bringing, in a way that really honors the fullness of humanity. We really try to identify what policies are actually actionable, that are actually happening, that actually at least reduce the disparities that we're seeing, particularly between Black and white communities, or Black and brown communities and white communities. So trying to really identify what are those policies that really seem to make a dent in the health. Again, when I think about health, I think about wealth, issues of mental health, physical health, all the sort of writ large health issues, but also issues around wealth, right, in terms of income, poverty, but also wealth and asset development, and also asset education from birth all the way through, you know, graduation. So what are the policies that really help to reduce those gaps in access, but also experiences and outcomes? And then we also think about mentoring and training, because in the end of it, there's only one of me, right? One of Dr. Wolf, right? One of Cherie, right? So how do we make sure that we continue to mentor and train, people to really connect the dots between research, policy, and practice, and really translate it, which is the final part of our larger work, is that to really make changes in society, particularly around issues of racism and inequities, we have to begin to change the water and the conversations, and make sure that people understand what are the economic ramifications when we don't address racial, discrimination. What are the ramifications we don't address health inequities? Everybody pays for it at some level or another, but if we don't begin to have those counter narrative translation and conversation, then things won't ever change it, at least in a transformative way that's necessary for our young people to thrive and really reach their best. Next slide, please. And so as I sort of, really lay down sort of the few things I wanted to kind of share with you all, is that, again, I'm probably speaking to the choir. So for all of you sort of 1,300 plus people that signed up and probably listening right now, is that, when I think about young children and children's development over the life course, is that we have to recognize, right, that there are peaks and valleys, right, that nothing is fatal. But what we do know is that for children to be healthy, there are things that are going to be really promotive, right? So we know that sort of the home environment that's promotive, that's affirming, that's sensitive, that's responsive, but also that's healthy in many ways, whether it's spiritually, physically, has the economic security, that those are going to place children at a stronger odds, especially in the first 5 years of life, when the brain is developing, when language is developing, that places children at a higher odd of having a successful life, right? Now compare that to children who experience in housing insecurity, economic hardships, different levels of trauma and early childhood adversities, right? That those children are sort of, likely on a track of potentially not reaching their potential. But again, I want to remind us that, especially for me as an early child person, we know that the brain is plastic. We know that children are resilient, right? And so it's not fatalistic when I say that, yes, you may be living in poverty as I was as a kid, or, dealing with a lot of different trauma. That doesn't mean that you're going to have a horrible life, but it does make it a little bit harder. And so what do we do to make sure that during those formative years that we're doing as much as we can in terms of policy work, in terms of programmatic, in terms of resources and supports? What are we doing to ensure that children are able to continue the life course in a way that's positive and optimistic, but really ensuring that they're going to thrive and live into their sort of older adult years? Next slide, please. But for me, it's really important. And again, I'm not going to do a history lesson here, but I want to make sure that we all understand and the previous speaker really spoke a little bit to that, right? That things are not felt similarly, right? Whether it's gun violence, whether it's mental health, whether it's COVID-19, right? They're not felt the same across various racial ethnic groups. But for me, it's important that we really call out, how does racism impact children's healthy development? And so what you see in front of you is, of course, the academic. We always have something complicated, but don't worry, I'm going to uncomplicate it shortly. But basically, this is a framework that we created in late last year to really communicate the different forms of racism, right? We have, when people talk about the water, right, the water that we're swimming in is really bathed in white supremacy, is really bathed in cultural racism. That means that we're really, that the things that are viewed as white or whiteness, or viewed as more superior, those who look white or white are likely to have the best outcomes in terms of education, economic drivers, for the most part, health, and other social indicators. And that's because the water just continues to churn that out. But that's because of the structural racism that we have pretty much baked into our education system, into our housing, into our labor markets, into our immigration policies. And so those structures really basically stratify people to have different kinds of opportunities over time. And of course, other things like interpersonal racism, which we call bias or discrimination, right? It impacts how individuals sort of interact with each other. And so my whole point of really showing this visual out is to say that racism in many forms is compounding different things, right? So for young children, right, they could be impacted by the kind of early education environment that they're in. They could be impacted by the adults and educators around them. They could be impacted by the neighborhoods that have been disinvested or underinvested in, or the violence within those neighborhoods. They could be impacted by the structural sort of racism in terms of the kind of access to economic supports, access to sort of educational opportunities that are high quality, right? So again, imagine the sort of the compounding nature of racism that impacts healthy development. Again, whether we're talking about physical development, social emotional development, mental health, that we have to begin to uncover all of these forms of racism that really impact children's healthy development. At the same time, we have to think about it intergenerationally. For young children, they're impacted by things before they're born, and then obviously after they're born. So what about issues of lead poisoning, issues of toxic and vicarious racism? Those impact children's healthy development either directly or indirectly, right? Whether through the parent, the mother, or the birthing person ingesting sort of lead or those sort of things, it impacts children's healthy development over time. But I want to also make sure that I sort of also elevate the cultural assets that many families and communities have, right? Even if you're living in poverty, even if you're living in many destitute spaces, we want to make sure that we'll call attention to the kind of assets that many families are bringing. For example, the different kinds of language systems that people bring when they're trying to communicate with those who are in their community or those in their cultural groups, or the kind of aspirations that many people have, right? The fact that you may be living in poverty, but you still aspire to greatness of education and many other things, even when it's probably sort of a hard road to get there. So we have to begin to sort of elevate the kind of assets that communities and children and families have, because we often look at them from a pathological lens, which is not helpful when we're trying to humanize people. So this, what we call RISE framework, is really trying to make sure that we are able to articulate what is racism in different forms, what is its impact on children's healthy development, but what are the cultural assets that families bring in many ways, and we shouldn't continue to ignore those level of assets. And we have measures of cultural assets, but I'm happy to talk about it later on. But these are just to make sure that we're able to see the full humanity in people. Next slide, please. And so just to sort of, I've done a lot of work and a lot of papers, and particularly, we've done a whole series around Black Babies Equity Project funded by Pritzker. And you can see the QR code. You can, when you go to that QR code, you'll get a copy. You can see this report. And what we've done over the past 2-3 years is to really elevate how Black parents and their babies are doing during the global pandemic of both COVID-19 and racism, what we call the dual pandemics, right? Racism has always been here. Black families have always felt it. Babies have always felt it some ways or another. And so we're trying to really elevate this idea of dual pandemic, right? And the report that you'll see is that it demonstrates that even 2 years into the COVID-19 pandemic, Black families in particular and their babies are surviving, right? Although they continue to feel the full weight of racism and discrimination, they're still being economically challenged, among other kinds of inequities, and it's still being compounded by the ongoing global pandemic. And we know that racism and discrimination, which is often not discussed enough, and especially when it concerns young children, that we know is still a major concern for Black families and their babies, along with economic instability. So, for example, I'll share with you a couple of data slides. Next slide, please. So in the report, there's a series of data slides that will compare Black families to other non-Black families. And we have data from pre-pandemic. So in this slide that you're looking at here, the darker shade red is pre-pandemic. And then the lighter shade is really March 2021 is a little bit darker. And then the lighter color is March 2022. And I should point out that this data is collected through a collaboration we have with Stanford and the Rapid EC team, which stands for Rapid Assessments of Pandemic Impact on Development in Early Childhood. And so it asks a series of questions around health, around economics, obviously around racism and discrimination, the part that me and team added. And what you basically see here is that really 1 out of 3 Black parents report the use of slur directed at them during the pandemic. And this rate actually decreased slightly between 2021 and 2022. And what you'll see across the board is that before the pandemic, right, there was a high level of parents reporting many variations of discrimination, whether police mistreatment, not being hired, being called a slur. What you can see is that obviously during the pandemic, when many people were actually locked away in their home trying to be safe for the most part, their Black parents with babies reported a lower frequency of that, right? So, but we know it's still happening. It's just that now your interactions with other people are not happening as frequently. But we also noted in our data that Black parents also reported concerns about unfair treatment of their children, particularly before the pandemic. So then this means that for families with young children, we're talking about children under the age of 3, that even that early in their life, parents are really concerned about how is their child going to be treated based on opportunities being provided. Will they be unfairly punished? And so parents are really already acutely aware that their Black child is likely to have these experiences. We see a similar trend for our Latino and our Asian families, not as high, but we see a similar trend where, minoritized families are having this sense of concern about how their children is going to be experiencing the world as they get older. Next slide, please. And so what you see here is another part of the data that really begins to call out that even as we went into the second year of the pandemic, that even over a quarter of Black families in poverty in 2022 were experiencing material hardships. Again, when you think about material hardships, we're talking about things like paying for utilities, housing, food, early care education, like childcare, healthcare, right? That many families are not able to do that. And that also includes Black families and middle income families. And so this is something that we have to continue to sort of, I think, push on, is that even when we think that you're middle income, you should be fine. For Black families who live in sort of economically vulnerable sort of positioning, right? But as they say, when it rains for some communities, for Black families, it pours, right? Is that same idea that even if you're middle class or middle income for Black families, you're still economically vulnerable. And so we can see in our data that over 10% of Black families who are middle income were experiencing almost 3 or more material hardships, meaning they couldn't pay for housing, for food, for utilities. And again, that has detrimental impact on the functioning and the psychological well-being of families, but also their children over time. Next slide, please. So, so the report shows a whole lot in terms of economics, in terms of health and stress, in terms of the sort of depressive sort of symptomology that parents are reporting, and we know those have implications for children's healthy development. And so, I encourage you to look at the report and series of other reports that we have really about Black families and their babies. And I will note that we also have a report around even the child tax credit and how that was actually helping families reduce their stress for Black families with babies, as well as Latina families with babies, right? That the child tax credit in particular was really powerful for Black and Latina families, and it reduced their level of stress, their level of depression and loneliness, right? And so we cannot sort of underscore how important some of our policies could be for many marginalized families. So as I sort of, leave and sort of, what are some things that we can begin to do, right? I could have shared so many more data, but I wanted to leave you with, like, what are some things that we're seeing that's really important and could potentially really be helpful in supporting the healthy development of children. And so I think about it from a 3P's perspective, right? So 3P's of protection, promotion, and preservation. So the first P is how we ensuring the children and families are free from harm, trauma, and adversity. Like, what are we doing to do that basic protection? The second is promotion, right? How we fostering children's health, right, including their physical health, their mental health, their social emotional health, all of that, how we fostering their health, but also their wealth, right? We talk a lot about poverty, but we don't talk about wealth, which is something that you earn over generations, right? So how do we foster wealth? And then obviously access to educational excellence. And then finally, preservation, right? We know that for a lot of the mental health challenges that we're seeing, we know that children and youth that are not feeling connected and seen and visible, that's impacting their sense of self. So how are we preserving their family, their culture, their land, right? Their language and their families and identity in many meaningful ways, right? So how are we doing what I call the 3Ps? And so I'll just briefly, next slide, please. So in terms of using the 3Ps, along with the National Black Child Development Institute, the foremost civil rights organization for young Black children, we created this, what we call the Black Child National Agenda, that really talks about what are the policies that we at least see working in many sectors, at least in many states across the country, that we think is going to really improve the health, the wealth, and well-being of Black children. And really, we argue if you do this for Black children and Black families and communities, this will actually benefit all children, families, and communities because of how much it focuses on really those safety nets and the things that really matter, right? And so I'll talk about them within the 3P. So the Black Child Agenda has 10 policies that we know evidence has shown is really impactful for their health and their wealth and many other well-being outcomes. Next slide, please. And so when we take a look at the Black Child Agenda crossed with the 3Ps, I want to just flag sort of like some of the how they connect, right? So if we think about protection policies, we know that we have to ensure that families are really free from racism and discrimination, but also material hardships. That means things like maintaining child tax credit and income supports. We've seen that been very beneficial for children's healthy development. We also have to address harsh and unfair discipline. we continue to see that Black children, Native children, and children with disabilities are likely to be harshly disciplined and suspended and expelled at a much higher rate than other children. And so we have to figure out what policies can we ensure that children are having the best experiences in early care education. Access to early intervention, right, and special education. Many Black and Native children are likely to be born preterm and low birth weight. And so how do we think about those issues? And then finally, promotion or policies around racial wage gap, Family Medical Leave Act, expanded health insurance, and access to early care education. And finally, preservation, right? How are we making sure that we're investing in Black-owned and Black-led businesses? How do we ensure culturally responsive curricula and practices? And really, how do we pass reparations, right? Because at the end of it, we have to continue to preserve communities to ensure that children are healthy and thriving. And then last slide, please. Next slide, please. And so really, as I sort of take into account, how do we continue to do this? How do we make sure these policies are not just localized, but really statewide and national, right? I argue we have to continue to engage in community partner learning. We have to think about, we do Black Babies Awareness Month and work with the Black media. We have the Black Child Agenda. We have to look at really our national studies. Do they address racism, sexism, classism, and all those kind of things? And we have to continue to mentor our younger people. Next slide, please. And we have to think about how we change the water and activating change. And this is an example of when we did our Black Babies Awareness Month. This means that we have to connect with the communities where they are, right? Whether it's local media, whether it's sort of social media feeds. How do we continue to push information that's really going to ensure healthy development of children and families? And so just the last slide, the last couple of slides, I want to just flag, right, again, if you go to the website, you'll see a slew of resources. Really, we take all of our peer review articles and we try to translate for policy and practice. Again, we cannot make a change without actually making sure that it gets translated to those who need that. And then finally, you can click to the next two slides for me, please. Again, look out for the new book we have coming out. And then, but finally, I'll just say, obviously, when we get to that, feel free to follow me on LinkedIn and Twitter. And of course, we have the website as well. So with that, I'll pass the mic back. Thank you.
Thank you so much, Dr. Iruka, for making clear the devastating impact of discrimination over the life course on our children, and how important correct policies are in community action to make a difference. Hopefully we can address that if we have a little more time for questions after this next presentation.